Don't forget to like and subscribe to our channel to get updates on our upcoming videos. Also, follow us on our social media platforms or send us your message through our Gmail address.
So, for today, we will be discussing basic anatomy terminologies. But before we proceed further to the discussion, if you like this video, kindly hit the like button and subscribe to our channel to get updates on the latest videos that will be uploaded soon. So let's start with the basic anatomy terminologies relative to position. We have the anterior, which means or describes structure that is in front of the body. So example, the face. And we also have the posterior, which describes structures that are located at the back of the body. Okay. So when you say anterior, anything that is in front. So the face is anterior. Okay. While this bone, which is called your occipital bone, is in the posterior. Now, here is another way when you can use the anterior and posterior. During infancy, these intersections here are actually open and they are called fontanelles. So, in the infant, the fontanelle that is found here is called the anterior fontanelle because it is in front, while the fontanelle that is found at the back is called your posterior fontanelle. The anterior fontanelle is shaped like a diamond, and the posterior fontanelle is shaped like a triangle. So next is medial and lateral. Medial refers to structures at the middle, while lateral refers to the structure at the side. Okay, so when you say medial, it is at the middle, and lateral, it's on the side. The next one is the palmar or plantar and dorsal. So palmar refers to a structure in the hand, while plantar refers to the structure in the foot. So let's put here hand, and we also have for the foot. Okay. So let's put some images here. So when you say palmar, this is the palmar. So you have here an image. This is the palmar, and this is the dorsal. When it comes to the foot, this is the plantar, the one or the surface that touches the floor. And this is the dorsal of the foot. Next, we have the superficial and deep. When you say superficial, anything that is on top, such as this layer of the skin. And when you say deep, anything that is found at the innermost part of the structure. That is your deep. The next terminologies that we will be discussing is the internal and external. So when you say internal, they are used to describe structures that is inside. When you say external, it refers to structures that are outside. This is most commonly used in muscles such as the external oblique muscle of the abdomen and the internal oblique muscle of the abdomen. We also have the internal carotid artery, which is found inside the cranial cavity, and the external carotid artery, which is found outside the cranial cavity. Next, we also have the ipsilateral and the contralateral. When you say ipsilateral, it is found on the same side of the body. While when you say contralateral, it is found at the opposite side of the body. So an example will be if there is a fracture at the right clavicle of this patient, okay, so if there is a fracture here on the right side, then all structures on the right, okay, is at the ipsilateral side. So if you would describe the condition of the right upper limb, then you can say on the ipsilateral limb, okay, meaning you are discussing the limb that is on the same side where the fracture is. So if this is the ipsilateral, then the other limb, which is the left limb, is the contralateral. Next, we have supine and the prone position. So this is the supine position wherein the body is lying on its back, while the prone position refers to the position of the body wherein the face is touching the surface or the face is lying downwards. Other than anatomy terminologies that discusses the position, we also have terminologies that are relative to movement. We have the flexion and extension. Okay, so this is an example of flexion and extension on the elbow joint. So as you can see, during flexion, the hand moves towards the shoulder, and during extension, the hand moves away from the shoulder. So this is extension, and this is your flexion. The next one, we have the abduction, which is the movement of a limb away from the midline of the body, and the adduction, which is the movement of the limb towards the midline of the body. So abduction, these limbs move outward, and adduction, meaning the limbs move inward. Okay, so now let's proceed to the movement of a part of the body along its long axis. So this is called your rotation, which involves two types. You have the medial rotation and the lateral rotation. The medial rotation refers to movement that results wherein the anterior surface of the body will face medially, while your lateral rotation involves the phasing of the anterior part of the surface laterally. This is your medial rotation. Medial rotation is defined as what we have discussed earlier, where your anterior surface, so when you say anterior, it's the front side, the anterior surface faces the medial side of the body or the middle side of the body. When you say lateral rotation, the anterior side faces the lateral part of the body. This is the lateral rotation of the hips. Next, we have the pronation of the forearm and the supination of the forearm. When we say pronation of the forearm, it involves the medial rotation of your forearm in such a way that the palm of the hand faces downward, okay, or it faces the back. When you say supination of the forearm, it involves the lateral rotation of the said structure so that the palm of the hand faces upward or faces anteriorly. Circumduction involves the combination in sequence of the movements of what we have discussed earlier, which involves the flexion, extension, abduction, and adduction. Next, we have the protraction. The protraction involves the movement of your temporomandibular joint or the jaw forward, while retraction involves the movement of the jaw backward. This is called protraction. Okay, as you can see, the movement of the jaw is towards the front. Okay, in this slide, we see that the movement of the jaw is opposite from what we saw earlier. So here, the jaw is moving backwards. Okay, so this is called the retraction of the mandible. Next, we have the inversion and eversion. Inversion involves the movement of the foot so that the plantar area faces medially, while eversion involves the movement of the foot so that the plantar area faces laterally. Okay, so when you say foot inversion, the dorsal part of your foot faces the lateral side, while the plantar area faces the medial side. So it is an outward rotation of your foot, wherein the dorsal portion will be facing the lateral side and the plantar portion will be facing the medial side. When you say foot eversion, the rotation of your foot is to the medial side. So the dorsal portion will rotate in such a way that it will face the medial side, while the plantar portion of the foot will face the lateral side. So that is your foot eversion. Here are the references for this lecture. So if you want to get updates on our latest videos, hit the subscribe button. Thank you.